Welcome, caregivers. In this skills training video, we will discuss administering nasal spray and nose drops to residents. Before contacting the resident, put on a clean pair of gloves and collect the medications from the secure storage area. Only prepare medications for one resident at a time to avoid any mix-ups. Review the medication administration record and the pharmacy provided label on each bottle to verify the correct resident, medication, dose, time, and that the order is current. The next step is to check the resident record to see if the resident has any allergies or any special instructions concerning the medication. Be sure to check the expiration date on the pharmacy-provided medication label. If the medication is expired or if an allergy is identified, do not administer the medication and follow the facility policy for clarification regarding the medication. Next, do a second check of the medication and compare the information on the medication label to the documentation on the medication administration record to ensure it matches. If it matches, continue. If it doesn't match, do not administer the medication. Follow the facility policy to seek clarification concerning the medication. It's time to go see the resident. Say hello and introduce yourself. Hello, Mr. King. I'm Jason. How are you? I'm going to be your caregiver today. I have some medication to administer to you. Can I verify your name and date of birth? Very good, thank you. One more question, Mr. King. Do you have any known allergies? No? Awesome! Next, explain to the resident the medication you will be administering. Do you have any questions or concerns about this medication? No? Okay. Ask the resident to sit up, and if it is helpful, to slightly lean forward. Okay, I can assist you with the most comfortable position. Let's get started. Wash your hands and put on a clean pair of gloves. It is important to follow the medication label and administer the medication at the time it is prescribed or scheduled. Do one final check to ensure you are dispensing the correct medication to the correct resident. To prevent contamination, caregivers should not touch the medication applicator with their bare fingers or hands. Read the label to verify the number of sprays or drops and if the medication is to be administered into one or both nasal cavities. Dispense the ordered amount of medication to the resident as indicated on the label and medication administration record. Use an alcohol pad to wipe the tip of the spray nozzle or bottle before administering the second dose. After preparing the correct dosage, return the pharmacy-labeled medication bottle to the secure storage cabinet. Okay, Mr. King. Are you ready for your nasal spray medication? Please sit up as straight as you can. Here is a tissue. Are you comfortable? Okay, I will administer the nasal spray now. First on the right, you will feel a rush of air and spray. Okay, good job. Wipe your nose if you need to, but please don't blow your nose. Now the left side, ready? You will feel that rush of air and spray again. Administer the correct number of nasal sprays or drops in one or both sides of the nose as indicated on the pharmacy label. Follow the directions on the label for the resident to use a tissue to wipe the nose, but not to blow the nose. Leave the resident in a safe and comfortable manner. Mr. King, is there anything else I can do for you? No? Okay, I am going to go now. Enjoy the rest of your day. If a resident refuses a medication, do not force the resident to take the medication or hide the medication. Document any refusals, complaints, concerns, and any action taken on the resident's medication administration record. Remember, any resident prescription medication refusal must be reported to the resident's prescribing physician. Properly remove and discard your gloves and use tissues. Never reuse any of these items. The final steps are to document the administration of the nasal spray or drops on the resident's medication administration record. Caregivers are to include the correct time, medication given, number of sprays or drops administered, the caregiver's initials, and any refusals or unusual complaints or action taken. That concludes our video skills training on administering nasal sprays and drops to residents. Thank you for learning with us today. See you soon.